Hi there, I'm Colin. I am 25 years old. This is my first video in a series of videos documenting my upcoming artificial disc replacement surgery. I'm getting an artificial disc installed on my C4, C5. My current C4, C5 cervical disc is herniated as well as a few others, but this is the only one that is compressing a ventral cord. And so it's provided a lot of discomfort to me over the last 15 months, ever since the trauma event happened. For a little bit of background, about two and a half years ago, or 2 years ago, I weighed 300 pounds. I had a lot of environmental shifts in my life that allowed me to just kind of reinvent myself in a way. I began working out 6 days a week, eating healthily, and it kind of became a real passion of mine. I really enjoyed it, and my mental health was just in immaculate condition. I think not only because I was becoming more and more healthy, but also just the fact that I was able to, feel proud of the work I was putting in, and doing things I didn't really want to do. And so anyway, fast forward, I experienced a few minor injuries, nothing due to really accidents on my part or mistakes that I made. However, the trauma event that caused my discs to become herniated, I was doing a shoulder press on a machine at a Planet Fitness, and I was doing a 12 or 15 set, I think it was 15, like 35 on each arm, so 70 total. And it was the very last rep, so I'm 14 deep, and I'm all the way up here, and on my left side, I was like a centimeter below, finishing the rep, and so I kind of like gave it a little shove, and I guess I stuck my head forward a little bit, and kind of learned my lesson the hard way. Following that, for around 10 minutes or so, it felt like somebody had poured kind of acid on my back left shoulder blade. It was not like anything I had ever experienced before. It was a very, very unique sensation that I was feeling. But I didn't think anything of it my entire life. I've been injured multiple times. Everything's always, stay out of the gym for a couple of weeks and you'll be back on your feet in no time. That's what I did immediately. I knew something was wrong, so I took 2 weeks off. I went back, did elliptical only. Wasn't gonna, try anything crazy. And even the elliptical made it hurt. So I took a few more weeks off of the gym, or maybe even a month, and then went back, cardio only, acted up again. Symptoms just included just feeling a kind of a tightness, when I tilt my head down into the right specifically. Shoulder blade aching. It feels like if somebody like tied a weight to my shoulder blade. It's just pulling it down. I really don't know how to explain that other than it's just aching. It's like an exhausting, aching pain. And then, that was pretty much it to start with, but it just got worse. The more that I did, the more it hurt in my neck and had some limited range of motion. So after the 2 breaks and going back and it not getting any better, obviously, I started getting pretty concerned, thinking that this might be something, more serious. And so I went to my physician, and he diagnosed a trapezius tear. So I believe he gave me steroids and sent me to a physical therapist. I was doing physical therapy for probably 2 months, 2.5 months, seeing no improvement. And we had kind of cycled through what exercises I was doing like 3 times. So like at that point, the third time they changed things, I was like, well, it feels almost as if like we're guessing now. So I was just exhausted at that point, and I wanted some real answers. So that prompted me to go back to my physician and get an order for an MRI. I had an MRI done on my shoulder, and it showed some minor arthritis or something like that, but nothing to write home about, nothing crazy, nothing to be worried about. Doctors still believe that was it. Physical therapist at one point said it could be a neck injury. He thought that maybe I should get a neck MRI as well, so prompted me to do that. The results of that first MRI were 2 or 3 herniated discs, one of which was impinging on a ventral cord, which is the C4, C5, the one that I'm having replaced. I went back to my physician with results, and he referred me to a pain management specialist. When I was seeing my pain management specialist, they told me that an epidural injection is the next option, and that it works wonders for a lot of people. So I was really excited, looking forward to that. I received the first injection in May of 23, and I didn't have any sort of reaction. I know when I actually got the injection itself, it hurt very bad. It was a very weird pain. I could not breathe for like 15 seconds or something like that. It was bizarre. I felt like my lungs were like being crushed, even though it was, in my back region. But following that, they said the first few days might be kind of rough. I actually flew to Vegas the next day. Went there on a vacation with my buddies. Didn't experience any out of the ordinary pain. It was always painful. It still is always painful, but it wasn't anything worse than usual. Following that, though, I experienced 3 to 4 weeks of very increased pain levels and symptoms introduced that I did not have before, some of which being like radiculopathy and things like that. I was not experiencing that prior to the first injection. Then they had told me that sometimes it takes multiple injections for it to really work. Sometimes these steroids or whatever wear off. And so you kind of have to like, double dose it, and then it works for like a year or whatever, and then you go back. I was like, okay, this is going to work. Everyone's telling me these work. Obviously, I want to do something to get my life back, essentially. And I was nervous because, it was very painful, that first one, the injection experience, as well as which is fine, it's temporary, but then the weeks following were just very, very, very rough. I was at increased risk for flare-ups as well. I noticed that my flare-ups occurred much more often following these injections. So I received the second injection, and no improvement, but not really any ill effects. So then I started having a surgeon at the same facility as the pain management specialist kind of manage my case and see, how are we going to get things better for me. And so he suggested, the last kind of options are to do a facet injection, the same epidural steroid injection. I believe they were changing the solutions slightly. Whatever they were injecting, they were changing the makeup of that slightly in between each of these as well, just because I wasn't reacting positively to any of them. So I had the facet injection done. Another same experience as the first one, 3 to 4 weeks of absolute misery. So much pain, like having to leave work because I just can't even think because I'm in so much pain. I do hear that these things work, so that's not to say they don't. I still recommend trying it because it does work for some people, and non-invasive treatments are definitely the way to go if they work for you. After getting the third injection and it only being worse, obviously it wears off and it gets back to kind of where it was to start with. They suggested that I get another MRI just to see if anything has progressed, so I went and did that. The newer MRI showed that the discs, well, the one in particular that was impinging is now compressing a ventral cord, so increased pain levels are to be expected, and that's kind of what I've been experiencing. And so it's a little bit more of a serious issue now, and maybe warrants, invasive techniques like surgery or artificial disc replacement or fusion. And so we had that conversation with my surgeon, the guy managing my case, so obviously he's familiar with it. It was kind of a last resort option. There's really nothing left to do, at least the way it was described to me. After the epidural injections, that's the preferred method. I had to think very long and hard about this. I've never had any sort of surgery. I've been under anesthesia twice, one for oral surgery and one for a different kind of operation. But oral surgery was not weird to me at all. It sounded perfectly normal. It was to remove an impacted tooth. That was fairly recently as well, maybe a year and a half ago or so. The idea of getting surgery on my spine was very frightening. I'm still a little bit nervous. I don't want to count my chickens before they hatch, I believe is the saying, but everyone keeps being optimistic for me, which is good. Obviously I appreciate it. People are trying to be supportive. For me personally, I feel like it's bad luck to be like, I'm for sure going to be good after this, honestly. So, I'm just kind of like taking it day by day. When I very first scheduled the surgery, like 3 months ago, I purposely prolonged it because I work in accounting. So year end is kind of a ordeal, and I had a vacation planned. I went to Mexico at the beginning of last month, January, about a month ago. My first time there, and I kind of wanted that. I wanted to go there and kind of, um, you know, end, I guess, on a high note. If something were to go wrong, it's not expected that things go wrong. The FDA puts artificial disc replacement as a 92 to 94% successful surgery. So, I mean, things should be fine, but I just don't want to. I don't want to say I know it will be, because if I have that expectation and it's not, um, well, I'll be much more disappointed than if I go into it kind of open minded as far as the result. For me, that works. Other people are different, I know, and they want to try to manifest, which, like, I'm, praying to whoever to, look out for me. And I think it should go okay. In those first few days after scheduling it, I was very distraught and just uncertain about my future and my life. I'd never experienced an injury that could be life altering or is life altering until now, and it had never really hit home until we scheduled the surgery. Even though I was relieved to be the kind of the final step, the thing that should for sure help me, odds are for sure help me, and to be there and not doing like these, oh, let's try this, and then if we get there to surgery, we'll do it. I was relieved to finally be at that step where it's like, all right, the real solution is here now. But at the same time, just the risks involved, just sketchy, honestly. Like, it's just scary. It's just not something I ever thought that I would have to go through. So I was reading all these statistics about the surgery. I was reading the pamphlet of the Mobi-C device, which is the artificial disc that I'll be getting, and reading Reddit and stuff like that. Not obviously like getting advice, but just reading firsthand accounts and watching videos of firsthand accounts. There are two YouTubers in particular. There are three YouTubers in particular that I would like to shout out for inspiring me to make these videos, because it helped me so much. Just on a personal level, being able to hear people's experience, their concerns, their worries, and then to see them come out of it, and in the cases that I watched, be okay and kind of reclaim their life. And it was very inspiring to me, because it's just more heartfelt than, you say 94% of people experience great relief and can return to normal life activities for the most part following this surgery. Even though 94% is high, but hearing one person talk about how it changed their life and helped them reclaim it, it's just so powerful. So there were three people in particular that documented their artificial disc replacement surgery and recovery. And those people are Sean Twomey, Raylan Batdorf, and Wojciech G. I apologize if I am mispronouncing that. It's been a long time since I watched these videos. I watched them back when I was trying to determine if I was doing it. We scheduled it, and then it was just kind of up in the air. I could cancel it if I determined that it wasn't for me. So I watched these videos around 3 months ago, way back in, I guess, November or October maybe. And so that's when I was unsure, I did a ton of research. I read all about the surgery, how they do it. I watched demonstrations of how they do it. I listened to surgeons, talk about how they do it, their experiences with patients, how well it goes, how bad it can go. Again, reading Reddit, watching videos, the whole nine. So I'm kind of an expert at this point. So listening to these people and in their accounts, as well as others, there were a few other YouTubers as well that documented their process. That was very comforting to me, and so that's why I'm making this. So anyway, hopefully, my next video is going to be on Tuesday. Today's Sunday. Hopefully, I feel okay that day, or maybe I should wait a day on Wednesday. Hopefully, I feel okay to make a 1-day post-op artificial disc replacement video and just kind of provide you with an update. In case I haven't covered it already, my symptoms now are some limited mobility some days, basically constant neck pain. I do experience ear pain that I believe is related to this, though it has not been directly clarified. It's as whenever this flares up, I do experience ear pain. Shoulder blade pain, which is the most irritating, the most painful, just that aching feeling like it's weighing down, like pulling me backward, like very, very uncomfortable. I do experience burning pains in my shoulder blade, on my tricep, and then some sharp pains at my fingertips and in my hand. And again, all of this, it's manageable. Honestly, it's very manageable, but only if I'm not doing anything physical. And that's just not the way I want to live my life anymore. I was such a happier person when I was able to, work out all the time and really take care of my body. I found that my mind was more at peace then. And so, I mean, that's the person I want to be in the life I want to live. And so if this is what I need to do to get there, which it is, there's no other option, at least right now, then I'll take it. And so I'm being optimistic again. Nothing is for sure, but I don't know. Hopefully I get some relief and I provide you guys with an update and let you know that my symptoms that I'm experiencing have disappeared, and the only thing I have is a sore throat, because that's what some people have said is they do no pain meds. It's outpatient, so I'll be going home. I'll be going to my parents for a few days following the surgery. I think it'll be good. I really don't have a choice. Sorry if I don't sound as well versed as I did a few months ago when I was doing all of this research to determine if it was a good idea for me. After I did all the research, I kind of landed on my decision, which is this is the best thing for me. And that was it. So I apologize if I left anything out of here. Let me know if you guys have any questions or comments or anything. This video is not medical advice by any means. Neither are the other ones that I'm going to be releasing. This is just for kind of for fun and to provide comfort the same way that other people that provided their firsthand accounts gave me comfort. But yeah, thank you guys for watching, and I hope this helped. And I hope to see you in a couple of days and be feeling better and on my way to recovery and living a normal life again.